Welcome to the Perspectives on Healthcare podcast, where members of the medical community from different roles, venues, and locations share their unique perspectives on quality healthcare, its future, and how to improve it. Now, from the Your Keynote Speaker studio in Pittsburgh, Pennsylvania, here is your host, Rob Oliver.
Welcome, and I appreciate you being with me today. My guests are George Cram and Patrick Frank. They are from Patient Partners. They are the co-founders, the CEO and COO, and they are both millennials. They are from out in California. They have all kinds of experience with orthopedics, bariatrics, women's health, cosmetics, general surgery, you name it. They've been there, done that, and seen it, and they've served the people that have gone through it. Listen, thank you guys for being here. I appreciate you joining me.
Thanks, Rob. Yeah, we're super excited to participate and kind of share a little bit about what we've learned.
You bet. So let's start right there. Tell me a little bit about yourselves and about your role in healthcare.
Yeah, absolutely. So, when I first started my career, I actually dove right into the medical device world. I worked very intimately with physicians, mainly making sure that products were being utilized properly. I lived in the operating room a lot, and I got to see a lot of what was happening from like an interoperability standpoint in the operating rooms, making sure cases were going smoothly. And I got to see a lot about patient care. And what I really saw was an opportunity of really kind of enhancing that patient experience and really kind of giving patients information and experience that I really thought that they deserved. And that's what kind of spun off and really my conviction into starting Patient Partner. And, Pat and I have been good friends for a long time. And when I saw this opportunity, this idea, I immediately called him on the phone. I'm like, man, I got something wild for you. Like, are you up for it?
And Q and me, I mean, my background is actually outside of healthcare, however, still very relevant in the sense where I come from consumer technology. And the largest consumer class in the entire US, if not the world, is us as consumers of healthcare. And, my entire background has been across a variety of different industries, but building and scaling out platforms, which, when George came with this idea of patient connectivity, what we realized is just like any other platform that we use, all it's done is taken the things that have happened out in the world and put it all into one single place. And so together from a perspective on, the actual introspective of healthcare and from a consumer standpoint, that's where we blend in and have where we are today.
Okay. So talk to me, this concept of patient connectivity. Tell me about this. What is it? How does it work? Tell me about kind of what it is that Patient Partner does that kind of, as you said, George, it was something that you saw as lacking in the medical organization, the way that it was functioning.
Yeah. So with working with physicians for so long, I got to talk with them a lot about ultimately like the patient experience. Where were they getting new patients from? When they had a really good patient outcome, what were the reasons why? And what I learned is the power of word of mouth, and ultimately finding somebody in almost like a support network as well. And you look at it from, when a physician operates on somebody and they have a good outcome, they'll go and tell their friends, or if one of their friends or family members or whatever it is looking for a procedure, they're going to go and talk with them about that. And in my eyes, that was an opportunity where I go, wow, why isn't this broadcasted on a bigger level? Like, these conversations are already happening. All of us are really guilty of it. When something happens, what's the first thing we do? We try to find somebody that we know to talk to about it. Well, and that's across so many different industries, whether it's you're going to a new city and you want to find a restaurant, you're going to try to call somebody that you know in that city to find a good restaurant. Same thing with healthcare. Obviously a bit more intimate, a bit more serious.
It's not a new city, it's a new life event, right?
Yeah.
That you're going through.
And that was what really I saw with working in the industry, is being able to take those patients out there and basically provide that network to everybody. And that's where Patrick really kind of came in and really added his what his specialty is and his background is really making those platforms come to life.
How do you deal with it? Like, I don't remember what the statistic is, but if someone has a good experience, they're going to share that with like 2 to 4 people. If someone has a bad experience, they will share that with like 8 to 15 people is the numbers that I've heard. So you're talking about capitalizing on that good experience model and broadcasting that. And are you as well cautioning on the bad experience model, or is it just a positive referral? How does that work for you guys?
Well, I think first I want to definitely jump in and say, I think those numbers now, as we've scaled out for technology platforms, it's expanded greatly, right? That 15 to 18 people that you might be sharing a bad experience with all of a sudden becomes tens of thousands, hundreds of thousands, because there's platforms to share those reviews on, right? You think of Facebooks, you think of Yelps, you think of all of these different review sites that exist in the world. The fact is, like, people are sharing their experiences. And especially in healthcare, there's so much negative confirmation bias out there in the world, right? Because in health, I mean, that's impacting you more than anything else. And everybody has, an incredibly emotional story to tell, especially if something goes the wrong way. And so on our side, it's not only do we want to shed light on the positive sides of healthcare, create awareness around, the potential of what these procedures and treatments have to offer to patients, but it's also, we don't want to be unrealistic by any sense of means, right? We have to be able to showcase every type of experience, but it has to be very realistic and the right type, right? Like, you have to think about, there's a difference between when you see a negative review, right? And it's well thought out, someone is saying something that is, eloquent in nature, right? Versus, a 15-page long rant, right? There's a very big difference there. And it's our job to be able to work together with the healthcare community and be able to showcase what these treatments and procedures are actually doing.
I mean, the proof's in the pudding. We have several mentors on our site who've had revisions.
Yep.
And they love talking about that. And we attract a lot of patients who want to learn from that, because not everything goes smoothly in healthcare. And being able to, not take on that risk is one thing, but also being able to talk with somebody who went through one of those bad experiences to figure out what exactly they went through and how they can learn from that. I mean, what an awesome resource.
Sure. And I think that you're also spot on with the numbers to say there are many more places that you can leave reviews and do that kind of thing. And I would posit that people leaving negative reviews are more energized and more convicted about what they're doing than people leaving negative or leaving positive reviews. What does quality healthcare mean to you?
Quality healthcare, in my eyes, is being able to give patients the full understanding of what their journey could look like. I mean, everything from the insurance navigation, understanding which insurance company you have, who's in network, who's out of network, understanding the deductibles. I mean, I read a stat the other day, almost 60% of patients have no clue how to actually understand their health insurance. Like, in my eyes, that's eye-opening. And then taking it a step further, being able to showcase patients and say, hey, you have this disease or this condition. What are all of your treatments? And highlighting all of the treatments available. And then being able to take it even a step further to say, man, you want to start learning about what these treatments can give or what these treatments can do for you? Why don't you just talk with patients who've already gone through that? Oh, and not only that, hey, let's make it incredibly relatable to you. Let's find somebody who is incredibly similar to you in your profile so you can have a really valuable conversation. And then last is being able to provide action after that. So we understand the insurance side of things. We understand, all the treatments. How can we help find and carve that pathway to care for you? In my eyes, that is the most quality experience you can have, in the healthcare industry.
And I'm going to sum all that up into just one simple sentence, is that quality healthcare is personalized healthcare. It is catered to you, your experience, and it holds your hand along every single step of the journey.
Okay. In some ways, what I'm hearing is like the tax code out there. I think about 90% of us have no idea how the tax code is actually written, and that's why accountants have a job, right? I'm assuming that in some ways that's a little bit like what you're doing, where the healthcare and health insurance is written in a way that is confusing for the average person, and they need someone to help them understand it and help do that. So you're the people that can be what an accountant is to a tax code, you are to health insurance. And I think, and take that as a compliment, not saying that you guys are dry and dusty and you sit in an office. Can you give me an example of quality healthcare?
Yeah. Well, to kind of go back on that statement, you're absolutely right. Tax code, think of, I mean, the law industry is the same way. You look at a contract and you're reading, you go, what am I looking at? Same thing with healthcare. They use big words that majority of people don't even understand. And then you expect the everyday consumer to understand and completely, rationalize what their journey will look like.
I want to add one more thing on top of this. And this is because my background is actually across the board on this. I've worked in finance, law, healthcare, so I could speak to it in the sense where when we think about an accountant, right, they exist to simplify the tax code and explain it to you and provide one service for you. When you think about an attorney, right, they know the law. Their job is to provide a service to you. The same thing for real estate agents, and also at the same time for physicians. They understand the human body. Their job is to provide a service, which is to operate on you and give you the best possible chance at a good outcome. The difference between healthcare and all of those other industries is that healthcare starts way before you need the service, and it goes on way after that service exists, right? It's not just that one instance. So we're almost, in your words, it's like you're the accountants of your entire life, right? Your entire journey through healthcare.
Yeah.
And I don't know if you want to share the example of quality healthcare that we recently had.
Well, I want to, the quality healthcare that we see routinely with our platform actually revolves around patients coming to us or thinking that they don't have the ability to find care and ability to find coverage. And it's simply us taking a look at, who they are as an individual, going back to Patrick's statement of individualizing the patient experience and saying, no, you do have options, and let me help you find these options. And we do this every day on our platform, is we give patients hope and we give patients access to care that they never thought they had. And that, in my eyes, is quality healthcare. Is going to somebody and saying, yes, you can. And let me show you how you do it.
Got it.
Go ahead.
No, I was just going to say that really leads me into the next question, which is, what do you wish people understood about your role in healthcare?
You want to take this one, Pat?
Yeah. And I'm going to look at it from an outsider's perspective. Again, now that I'm in healthcare, in an entrepreneurial spirit, I mean, you think about it is that healthcare has historically been by the most slow to adopt industry for technology and personalization in consumer experience. And simply what all those big words is saying is that it has fallen behind every other industry that we interact with how they have catered the experience. And mind you, there are a lot of complexities, regulations across healthcare. And what I really want to tell people, and what people may not understand about a new and emerging technology or company in healthcare, is that yes, there are all of those barriers, right, to entry. You have to work with physicians, you have to work with med tech companies, hospitals, insurance companies. But the fact is that at the end of the day, if you focus on the patient, if you focus on giving the patients what they need, every single one of those industry participants will figure out how to work with you. To be focused on the patient first.
Got it. And in some ways, it's interesting because the old viewpoint in medicine was kind of the patients need us, and the patients are coming to us. You're talking about them as patients, right? You're not talking about them as customers. And when you change the paradigm and you begin talking about them as customers or clients and having other options that are available, it really makes a difference in the way that people are treated and the way that you view the people coming into the office. It's a very interesting.
I love that statement. I think that's a really powerful statement that you just said, is that historically healthcare is looked at and say, oh, the patients need us. In order for all of these institutions and practitioners and companies to exist, they need the patients.
Yeah. It's a major shift that needs to happen. What excites you about the future of healthcare? And in some ways, I would imagine being part of the future of healthcare.
Yeah, I mean, there's several elements that I'm like super excited about the future of healthcare. A lot of them are surgical, surgical devices that are coming out that are really I think it's gonna change the game for the surgical community. But what I really think is going to be monumental for healthcare is kind of going back to that statement of like bringing healthcare revolving around the patient and giving patients access and resources to use and technically leverage to make sure that they are finding the best care. What ends up happening, and the reason why industries go leaps and bounds in evolution and really advancing, is when you have to keep up with consumer demand. And when patients are demanding a certain level of care and they know that they can go somewhere else to get it, industry will catch up.
It has happened. I'm telling you, this has happened in every other industry. Consumers have caught up to what they realize they have a certain level of demand of experience, and companies have either come and gone and as emerging as the victors of who's been able to provide the best experience and the most simple experience. Like for me, what excites me the most is like being able to define the pathway for patients of all different backgrounds, define their pathway in healthcare.
Yeah, it's really interesting because I think to go back to it, it used to be that, each town had its local hospital and they were the only gig. And like, if you wanted healthcare, that's where you went. And now they're seeing that, okay, people are willing to travel to get different care in different places. A very big shift in the way that things are handled. What is one thing medical professionals can start doing today to improve the quality of healthcare?
I mean, I don't want it would be like a shameless. Go here.
So if I was a healthcare professional and I had to change ultimately one aspect of the healthcare experience, I think it would be focusing more on how they can provide an incredible service to their patient. Too many doctors see a patient as a number. And in my eyes, that needs to change dramatically. And being able to provide an incredible experience, not only from the point of when somebody walks into your office, but even after that, it's going to go leaps and bounds, not only for the physician as growing their brand and who they are and making sure that their reputation stays high, but it'll allow for patients to come back and go, hey, I'm going to recommend this to my friends, or better yet, how can I continue to evolve the practice of this individual? And again, it all starts with making patients feel special. And if I was a physician, I would heavily focus on that.
And Rob, I want to add on top of this is like you just mentioned, it's like, historically there was like one hospital, it was the only gig in town, the only places patients could go, right? The fact is like the world is becoming a digital village, right? Like every single individual on this planet is accessible with this, right? I can contact anybody in the world with this. And so this is not a far off reality, is that at any point we're actually doing right now with telehealth, right? You can connect the top physicians across the entire world as a patient. You don't have to drive anymore. You don't have to fly. You could talk to them right now, just like we're talking to each other. And if you look at patients like a number, right, they can very easily access someone who does not. And so it's catering to that change, that paradigm shift.
Yeah, I think that's a very alarming message, or a very encouraging message, depending on what your style of interaction is with the people that you serve. It's a reminder, hey, if I don't treat them well, they can go somewhere else and they can get treated better. And it's a very empowering message as well for the folks that are going through, experiencing healthcare, to say, hey, if you're not getting it where you are, look for other options. And I think that gets back to really the heart of what you guys are doing, is helping to educate the consumers of healthcare about what their options are and how things can go for them. Listen, George and Patrick, thank you guys so much for being here. I appreciate you sharing, and I appreciate you giving us your perspective on healthcare.
Thanks for listening to Perspectives on Healthcare. Visit perspectivesonhealthcare.com to learn more about Rob Oliver, or to subscribe so you never miss an episode. If this podcast was valuable, we'd appreciate a review on iTunes. Or if you tell a friend or coworker about the show, that would be helpful too. Join us again next time for more Perspectives on Healthcare.